Hi, welcome to Professional Certifications channel. Let's break down CISSP exam preparation, one topic a day for focused and effective learning. Today's topic is Health Insurance Portability and Accountability Act, HIPAA.
Definition: the Health Insurance Portability and Accountability Act, HIPAA, is a U.S. federal law enacted in 1996 that sets standards for protecting sensitive patient health information, PHI. HIPAA governs how healthcare providers, health plans, and other organizations handle, store, transmit, and protect PHI to ensure patient privacy and security. It also provides individuals with rights over their health data. HIPAA is highly relevant to information security because it imposes strict requirements for the safeguarding of electronic protected health information, ePHI.
Key concepts.
1. Purpose of HIPAA. The primary goal of HIPAA is to protect the privacy and security of patient health information, while also ensuring that individuals have rights to access their medical records. HIPAA applies to healthcare providers, health plans, and other covered entities, as well as their business associates who handle ePHI. Protect patient privacy. HIPAA requires organizations to implement safeguards that protect the confidentiality, integrity, and availability of patient health information. Ensure data security. HIPAA mandates technical, physical, and administrative controls to protect ePHI from unauthorized access, breaches, and misuse. Provide individual rights. HIPAA grants individuals the right to access their health information, request corrections, and know how their data is used and shared. Standardize data handling. HIPAA establishes standards for how healthcare data is transmitted, stored, and shared, ensuring consistency across the healthcare industry. Example: a hospital implements encryption and access controls to protect patient health records, ensuring that only authorized personnel can access sensitive information.
2. HIPAA Components. HIPAA consists of several key components that establish privacy and security requirements for handling patient data. These include HIPAA Privacy Rule. The HIPAA Privacy Rule establishes national standards for protecting the privacy of individually identifiable health information. It limits the use and disclosure of PHI and gives patients rights over their health information. Key provisions: restricts who can access or receive patient information. Requires organizations to provide patients with a notice of privacy practices. Grants patients the right to access, request corrections, and obtain an accounting of disclosures of their health information. Example: a healthcare provider provides patients with a notice explaining how their health information will be used and shared. HIPAA Security Rule.
The HIPAA Security Rule establishes standards to protect ePHI that is created, received, maintained, or transmitted electronically. It requires covered entities to implement physical, administrative, and technical safeguards to secure ePHI.
Key provisions: administrative safeguards, policies, training, and risk assessments to manage the protection of ePHI. Physical safeguards, measures to control physical access to facilities and devices that store ePHI, e.g., locked doors, badge access. Technical safeguards, encryption, access controls, audit logs, and secure communication channels to protect ePHI from unauthorized access. Example: a healthcare organization uses encryption to protect ePHI stored on its servers and implements multi-factor authentication for accessing electronic health records. HIPAA Breach Notification Rule. The HIPAA Breach Notification Rule requires covered entities to notify affected individuals, the Department of Health and Human Services, HHS, and in some cases, the media when there is a breach of unsecured PHI. Key provisions: notification must occur within 60 days of discovering the breach. Breaches affecting 500 or more individuals must be reported to the media and HHS. Breaches affecting fewer than 500 individuals must be reported to HHS on an annual basis. Example: a healthcare clinic experiences a data breach where unencrypted patient records are accessed by unauthorized individuals. The clinic notifies affected patients, HHS, and local media within the required time frame. HIPAA Enforcement Rule. The HIPAA Enforcement Rule outlines penalties for noncompliance and establishes procedures for investigations and hearings related to HIPAA violations. Penalties. Fines for HIPAA violations range from $100 to $50,000 per violation, with an annual maximum of $1.5 million, depending on the level of negligence. Example: a healthcare provider is fined for failing to implement adequate security controls that led to a breach of patient records.
3. Protected Health Information, PHI, and ePHI. HIPAA applies to protected health information, PHI, which includes any information about an individual's health status, provision of healthcare, or payment for healthcare that can be linked to a specific individual. Electronic Protected Health Information, ePHI, is PHI that is created, stored, transmitted, or received electronically. PHI Examples: medical records, treatment plans, diagnostic information, billing information, and any data that can identify an individual, e.g., names, social security numbers, addresses, birth dates. Example: a hospital's electronic health records system contains ePHI, including patient diagnoses, medical treatments, and personal information. 4. Who must comply with HIPAA? HIPAA applies to covered entities and business associates that handle PHI and ePHI. These include covered entities: healthcare providers, e.g., doctors, hospitals, clinics; health plans, e.g., insurance companies, HMOs; healthcare clearinghouses, entities that process non-standard health information into standard formats. Example: a doctor's office is a covered entity that must comply with HIPAA when handling patient medical records. Business associates: any organization or individual that performs services for a covered entity that involve the use or disclosure of PHI. This includes IT service providers, billing companies, cloud storage providers, and legal firms. Example: a cloud service provider storing healthcare data on behalf of a hospital is considered a business associate and must comply with HIPAA requirements. 5. HIPAA compliance requirements. Organizations subject to HIPAA must comply with several key requirements to protect PHI and ePHI. These include risk assessment. Conduct regular risk assessments to identify potential threats to the confidentiality, integrity, and availability of ePHI and implement appropriate safeguards to address those risks. Example: a healthcare organization conducts a risk assessment to identify vulnerabilities in its electronic health record system and addresses risks such as unauthorized access and data breaches. Access controls. Implement access controls to limit who can access ePHI. This includes role-based access control, RBAC, and multi-factor authentication, MFA, to ensure that only authorized personnel can view or modify patient data. Example: a hospital implements role-based access control, restricting access to ePHI based on job roles, such as doctors, nurses, and administrative staff. Encryption. Encrypt ePHI both at rest and in transit to protect it from unauthorized access or breaches. Example: a healthcare provider encrypts all patient data stored in its databases and ensures that data transmitted over the Internet is encrypted using secure protocols. Auditing and Monitoring. Maintain audit logs that record access to and modifications of ePHI. Regularly review these logs to detect any unauthorized access or suspicious activity. Example: a healthcare provider uses an auditing system to track and log all access to patient health records, ensuring that any unauthorized access can be identified and investigated. Training. Provide regular training to employees on HIPAA requirements, data privacy, and security best practices to ensure they understand their responsibilities for protecting PHI. Example: a healthcare organization conducts annual HIPAA training for all staff to ensure they are aware of their roles in protecting patient data. 6. Penalties for HIPAA violations. Non-compliance with HIPAA can result in severe penalties, including financial fines and legal consequences.
Penalties are based on the level of negligence and can range from minor fines to significant penalties for willful neglect. Tiered penalty structure. Tier 1, $100 to $50,000 per violation, up to $25,000 per year for violations due to reasonable cause, non-willful violations. Tier 2, $1,000 to $50,000 per violation, up to $100,000 per year for violations due to reasonable cause but with some degree of negligence. Tier 3, $10,000 to $50,000 per violation, up to $250,000 per year for willful neglect violations that are corrected within 30 days. Tier 4, $50,000 per violation, up to $1.5 million per year for willful neglect violations not corrected. Example: a healthcare provider is fined $500,000 for failing to implement encryption on portable devices, resulting in a data breach that exposed patient health records.
7. HIPAA best practices. To ensure HIPAA compliance, organizations should adopt best practices that focus on protecting PHI and ePHI and minimizing the risk of data breaches. Conduct regular risk assessments, regularly assess the risks to PHI and ePHI and implement security controls to address identified risks. Implement strong access controls, limit access to PHI and ePHI to authorized personnel using role-based access control, RBAC, and multi-factor authentication, MFA. Use encryption, encrypt all ePHI both at rest and in transit to protect it from unauthorized access. Regularly train employees. Provide employees with regular training on HIPAA requirements and best practices for handling PHI and ePHI securely. Maintain audit logs. Keep detailed logs of access to and changes made to ePHI to detect unauthorized access or modifications. Example: a healthcare provider ensures HIPAA compliance by conducting annual risk assessments, encrypting all ePHI, and providing employees with ongoing HIPAA training.
Importance in the CISSP exam. HIPAA is a key concept within the security and risk management domain of the CISSP exam. CISSP aspirants must understand the HIPAA privacy and security rules, the requirements for protecting ePHI, and the penalties for noncompliance. Exam questions may focus on the security measures required under HIPAA, the role of covered entities and business associates, and best practices for ensuring HIPAA compliance.
Real-world example: a healthcare provider encrypts all patient health records, implements multi-factor authentication to protect access to ePHI, and conducts regular HIPAA training for staff to ensure compliance with privacy and security regulations.